All right. Okay. So welcome to our monthly meeting, and I appreciate everybody taking out their time to meet with us today. I will try not to hold everybody too long, but we'll hit a few important topics, and then get you guys on your way. We're going to start off with a roll call as normal. So we'll start off with our hospitals. We'll start off with Anderson Hospital.
Eric Searfield.
Thanks, Eric. Good morning. Alton Memorial.
Good morning, Phil. It's Ashley.
Good morning, Ashley. Boyd.
Nancy here.
Hey, Nancy. Good to hear you. Carlinville Area Hospital. How about Staunton?
This is Sue. I'm here.
Good morning, Sue. How about good folks out at Fayette?
I'm here, Phil.
Hey, good morning, Tina. Thank you. Gateway. Rick or Danielle, Gateway? Not yet. Okay. We'll go through our HSHS partners. Holy Family.
Hey, Phil. Ashley's on.
Thank you, Ashley. St. E's.
Brad Perry's on.
Morning, Brad. Thanks. St. Joseph Breeze. How about Highland? Okay. Jersey. Jersey Community Hospital. Nope. Okay. Here at Memorial, you got myself. Obviously, you've got Scott Klosterman, who's on. Lee's on as well. They're both actually over at our vaccine clinic this morning, hustling and bustling, making a few changes over there. And Eric, I'm trying to see if Eric is on right now. Eric, are you on? I'm just trying to scroll through. I don't hear
If
Eric.
you're looking, Eric Perham, I think, is still out with Mike and Alton.
Oh, it's at Alton. Okay, perfect. No problem. Thanks, Lee. All right. Let's get over here for Chester Memorial.
Hi, Georgia's here.
Hey, Georgia. OSF St. Anthony's.
Yeah, Gary's here. Also got Dennis Stanford here, our EMS coordinator.
Oh, perfect. Thanks, Gary. Welcome, Dennis. All right. Redbud.
Yes, Diane and Tara are here.
Good morning, Diane and Tara. Thank you. Sparta.
Dan's here, Phil.
Dan.
Dale is also.
Okay. Thank you. Thank you. Touche.
Eric's here.
Gotcha. Gotcha, Eric. Thank you. Health departments. Bond County. Calhoun County.
Megan Eilerman at Calhoun.
Thank you, Megan. Clinton. Anyone from Eastside Health District? Fayette? Greene County? Jersey County?
Heidi Carter from Jersey County here.
Thank you, Heidi. Macoupin County?
Derek's here, Phil, from Macoupin.
Thank you, Derek. Madison County? I'll give Michelle a second to get from underneath the rubble. I know she's been jiving. No one from Madison. Okay. Monroe County? Randolph County?
Angie's here from Randolph.
Thank you, Angie. And St. Clair County? Sam or Mila, St. Clair? Nope. Okay. Our RMSC, Greg, you on?
I am on.
Thank you, sir. Emergency Response Coordinator, Beth, you on?
Good morning, Phil. I'm here.
Thank you so much. Any of our BJC partners on today? Any of our county EMAs on today?
Phil, I'm sorry, I couldn't get off mute. This is Chris Blank with BJC.
Hey, Chris. Thank you so much.
Thanks.
Again, we'll go back. Just any of our emergency management agencies from the counties on today? Okay. MedStar Ambulance? Chuck and John try to jump on. They've been on a few. I see. Trying to see. Nope, he's not on yet. Okay. How about Abbott?
Leslie from Abbott is on.
Gotcha. Thanks, Leslie. How about SLU? Any one of our Scott Air Force Base partners on today? Tim or anyone from the crew? Not today. And any of our stars folks on today?
This Dale.
Gotcha, Dale. Thank you so much. If you are on and I have not heard from you, I know we got a lot of folks that have called in. Here's your opportunity. We'll take about 2 minutes if you just want to sound off, and we'll get it recorded and we'll get you annotated.
Rick Wolf at Gateway.
Hey, Rick. Gotcha. Thank you. Any other community partners, organizations on that did not get a chance to? Okay, well, we'll pause there with that. Thank you so much. And if you do jump on before we close, you can always either shoot me a chat message in the chat and let me know that you're on, or shoot me an email, say, hey, I was on, just couldn't get off mute or what have you. So, all right, we'll go ahead and move on. We're gonna pretty much got our standard agenda here. We'll start off with our COVID-19 update. As you guys have probably noticed, if you've been reviewing the charts every day or, across the weeks, we are now hitting a very good low, I would say. Very encouraging to see that we continue to trend in the positive direction. And by positive, I mean lower census across the region. So hats off to you guys doing lots of work. I know our census was a little low today here at Memorial. Not sure how you guys' censuses are. And I'm not just speaking COVID generally, I'm talking about overall. Today was a little bit low, but our COVID patient census has been very low. And that's a good thing. And I hope we can continue to maintain it. We've talked about it several times before, but there are still a few hot spots across the state. You may have noticed that there are a few, when you get those siren messages, that those numbers, go up. At some point, we're sub 1,000, positives, and then you go back up to 3,000 positives on certain days. So, hoping for the best that folks will continue to, not just, run with the good news and put us potentially back into a third wave. We'd hate to go backwards. As you guys have seen across Europe, they're currently fighting basically a third wave there, and a little disheartening to see that occurring today. But hopefully we'll be able to push through. So great numbers, great work. Thank you so much for what you're doing day in and day out. I know that folks are tired, but we're almost there. One of the things that we discussed at our just in our hospital today, as a part of our daily, what we call our tier 3 huddles, we were talking about PPE wear. We're starting to see a little bit of fatigue on the staff side of folks saying, well, they'll get in break rooms or they'll get into congregate settings and folks are reducing their PPE. Our infectious disease doc here, his biggest pet peeve so far has been eyewear when dealing with patients. But the secondary part of that has been our, communicating with each other and folks kind of just, whether they're dropping their guard, removing their masks and just, we're vaccinated, we're vaccinated. We still don't have definitive guidance on whether or not you can, still potentially be infected and pass that on to someone else, whether it's a coworker, a patient, or visitor that may not be wearing their best PPE either. So highly encouraging you folks across the region, whether you're in a hospital setting, in the back of an EMS truck, or if you're in hospice or wherever you're working at a dialysis center, continue that good PPE wear. We're going to keep riding this out because we got other encouraging numbers that I think we can talk about here. And it talks about our vaccine numbers. We'll start with our region numbers as far as positivity rate. You see that's 3%. We've been holding steady right around that 3% for quite some time. We did drop down to 2.8%, which was, again, very, very encouraging. Hopefully we can drop back down into the 2%. Our ICU bed availability has been around 33% now, so that's continually staying above the 20% by a substantial margin there, and actually on the rise over the last 5 to 10 days. So other good encouraging news. And as you can see, the vaccine data, I took these again fresh this morning from what we're looking like across the region for each one of the counties there. You guys are doing so well. I mean, it's just, again, very encouraging to see the numbers that we're seeing out there of folks getting vaccinated. As you can see, we're about 19%. We have about 19% of our folks. Well, that's the average percentage for all of our counties there. But, fully vaccinated, 161,000 folks. We're talking about in our region, that's 1 in 5. And that's, again, super encouraging. We got 1 in 5. But what I can say, at least from both on a regional standpoint and from a hospital standpoint, that the curve for the vaccine is beginning to flatten. Initially, for those of you who ran vaccine clinics or participate, volunteer, or running in one primarily, you probably remember initially when we started doing the vaccines that there was a very high demand, but that demand curve is starting to lean the other way, or flatten, if you will. So, not sure how much we can do from an organizational perspective. Because, if I'll share our BJC numbers, we're still, and Chris, correct me if I'm wrong, we're still below 70% for BJC employees in being fully vaccinated and being fully vaccinated. And that trend, is probably going to, if we're in the hospital settings, that trend is probably going to be that gap is probably going to be a little bit wider potentially in the public setting. So not sure where we end up in the next 3 months. But if you take out those who will probably never get the vaccine, let's be conservative, maybe around 20% of those not getting the vaccine, and those who can't get the vaccines, less than 16 years of age or higher, just if you look at our census data generally, 18 and below take up approximately 24% of the population. So let's say around 20% of that population. That's about 60% left that are those who are probably going to get vaccinated. You do that over 330 million across the entire United States. That puts us somewhere at around 165 million folks getting vaccinated. And as of today, I think I did not include those numbers in here specifically, but I was looking at them here a second ago. Give me one quick second. And as according to the CDC, we've administered 169 million vaccines. At 108 million have at least one dose, and 63 million being fully vaccinated. And again, that is a percentage of the total population, or eligible population, right where we're at currently today, right at 19%. So we are following the trend of the entire country. And what we see, whether it's across the river, in another state, up north, doesn't matter. It looks like we're trending in a very positive direction, but we're starting to slow down on being able to get folks vaccinated. We've got plenty of vaccine here in our region, it looks like, but now folks are just, again, whether they're gun shy or they're, just not going to do it, starting to have vacancies now. So I wanted to pause here for a quick moment and ask Greg if there's anything that he'd like to share from a vaccine perspective from IDPH, and if any of the folks on the call had any questions they wanted answered, or wanted to share any information with regard to vaccine clinics that you may be conducting yourself. So Greg, is there any other information that maybe I missed from maybe Dr. ZK, or some things that we could share?
I'll leave any of that to Beth for the most part. The only thing that I would add is that our EMS, which is the focus of my position, we now have 3 systems that are working with some of our larger health departments right now in trying to get our homebound residents in those counties vaccinated. So that's a really positive point there, because we know how difficult that can be to get out there. So that is probably that actually just started last week with one of the systems, and the two other systems had approvals this week, so they may be able to speak to how that is starting to roll out for them. But that's a positive for the region as well, because I think we may be the only region right at this point that has 3 EMS systems willing to participate in that and have already gotten their plans in, and they've already been approved. So Beth might be able to add some more about the actual vaccine rollout, as she probably has more of that information.
Indeed, indeed. So, thank you so much. And again, we've been championing our EMS providers. They've been a great asset for us here across the region, and we've been leading the way. I kid you not. And it's just a testament to the flexibility and teamwork that this region has. I want to give a quick shout out to Brad Perry over at St. E's. I can tell you this. I mean, he's been running our regional kind of EMS calls that we do every Wednesday for quite some time. And, I know it gets very tedious to do that, but that's where we do a lot of this collaboration and talking and trying to move folks forward with, initiatives like this. So to the Abbotts and MedStars, whether you're Millstadt, O'Fallon, you pick someone across this region. Staunton, EMS, doesn't matter. You guys have been super and at the tip of the spear at every point in this. I got a medic right now giving vaccines here in our vaccine clinic, and somebody basically doing traffic control, not in the parking lot, but just with patients, getting them to where they need to go in the vaccine clinic right now. And again, that's from our EMS provider. So thank you, Greg, for reminding me of that. And Beth, do you have any additional vaccine related information that you'd like to share?
Well, as predicted, the system has switched here in the last few weeks, where, as we all know, there was a huge demand, and now we have open slots. We knew this was coming. It's a good problem on one side. Hopefully, people will continue to get vaccinated. We need the numbers to get that herd immunity. So I know that there's some efforts going on at the state level, and I know the PIOs are meeting right now in the region to discuss what we can do to encourage people to get vaccinated. And there's a lot of different resources and methods out there that we can use. I know that I think it was St. Clair has started allowing walk-ins in addition to their mass vaccination appointments. They're allowing people to just walk in without an appointment. I think the key is to make it easy and convenient for people to get the vaccine. And then, like Greg said, I've said it a bazillion times, I'll say it again, it's the best region in the state to be able to be the first ones and the like you said, 3 EMS systems to be able to use their staff to give vaccination. That's wonderful. Something else that we've noticed that I'm not sure if everyone knows is that people are driving from far away to come to the region to get their vaccine. I know that they saw this in Missouri, and we're seeing it here in Illinois, people who are driving down from Chicago to get vaccinated. So as long as our health departments are willing to do that, which I think is great, the more people we can get vaccinated, the better off we're going to be. One more thing I wanted to say before I forget. This week is Public Health Week. So happy Public Health Week to all of our public health workers. It's been a challenging year, and I would like to acknowledge all of the very long hours and Herculean efforts that everyone has put forth in this last year. So I'm available if anyone has any questions, and I think that's all I have for now, Phil.
Thank you so much, Beth. That's I didn't know it was Public Health Week. I did not know that. So happy Public Health Week to the team. And you're absolutely right. We do have probably the best region in the state as a model for a lot of folks on a lot of initiatives. So again, thanks to all the hard work that the folks are putting in. And that kind of leads me into this next slide, and that talks about the FEMA public assistance. We did discuss this, I think, last week or the week before last. Um, but during the last LHD call, I think it was last week's LHD call, Monday, there was discussion. IEMA did put on a briefing with regard to FEMA public assistance, and it was specifically talking a lot about COVID-19 vaccine public assistance. One of the things that I wanted to make everyone aware of, if you did not already know, is that traditionally, if you guys know anything about the Stafford Act, when we do have a federally declared national disaster, the reimbursement cost share is normally at 75-25%. The feds basically would cover, qualifying reimbursement requests up to 75%. And, so then that means the business agency would be able to, only spend a quarter of what it would cost to reimburse things for whether it was equipment, supplies, et cetera. But they're moving this out to 100% cost share through 9/30/21. So at the end of fall or beginning of fall this year. That's a rarity, I will tell you. And as we were talking about our EMS providers in the hospitals and everyone that's put forth, especially these private agencies that have put forth an effort, and they normally kind of do it out the goodness and gracious out of their bottom line a lot of times, but you don't have to do that. You pay taxes for a reason, and this is not a political discussion, but that's what some of this is there for. That's why we do what we do when we do it. That's why the Stafford Act was created. So just, this is just a kind of a summary of what was in that briefing. I did send out copies of the slides last week when they were provided. But anything from PPE supplies for administering, handling, storage, and transportation, facility costs, leasing a space. If you, like, we took over a space in one of our medical office buildings and had to do, in a week's time, we reconstructed that into a vaccine clinic. Those costs for staff that you bring in, the hours that you're putting in, we got EMS folks that are putting in hours at, whether it's a county site or an organizational site, a lot of that is reimbursable. So I highly, highly encourage each and every one of you, if you have not done so already, have your, whether it's your chief financial officer, whoever handles the books, the accountants in your organization, go out to the IEMA website. They have a full package out there. That link that you see on the slides today will take you directly to that website. You can download those packages and you can start to recoup those dollars and get them submitted. You will have to create a portal, like a FEMA portal account. It is not very difficult. Now, anything with federal government is always going to be a lot of paperwork, but they've put all this stuff in packages and put examples in there for you to follow. So again, I highly encourage each and every one of you guys to go to the link. And if you do have qualifying expenses and you need to submit some form of reimbursement, work with your local EMAs, but I don't want to say take advantage of it, take the opportunity to apply, and hopefully you'll be reimbursed over the next year or so. I don't know how long it's all going to take, but the funds are available. Now, a lot of that conversation was about COVID-19 vaccine support on the IEMA call. I did not get a full clarification if the 100% was going to all COVID response, but they did say it was dating back to January of 2020, so far as that you can qualify for. So again, I am not a financial advisor. This is not financial advice, but I would again highly encourage you to go out to that site and see exactly what you can qualify for. So I would like to pause. Greg or Beth, you've probably dealt with this at least some, or have had some questions or been in other briefings. Is there anything I'm missing or things that you've heard that we should be sharing with the region?
This is Beth. Phil, I told my health departments yesterday to work with their local EMA they are probably a little more versed than we are here in public health to go through that process. You're right, it can be complicated, but there is a lot of availability out there too.
And I'll echo that. I know a lot of you aren't on our weekly or now every other week EMS call we've been having. And Beth is right. Local EMA is very well versed. They've been very informative on those EMS calls. So I would encourage you to reach out to them with questions, since that's kind of the IEMA and EMA side of things. They're going to be able to give you a much better direction, I think, than Beth or I could.
All right. Thank you so much. I'm going to pause here just for a moment for any questions that we may have on the line now, so we don't have to, so we don't, forget if you do have any questions.
Phil, I have a question about it's
yes.
COVID related. How's that?
Yeah, that
I
works.
heard in a call I was on this morning that hospitals may be moving away from doing temperature checks upon entry. Have you heard anything about that?
I personally have not. I know a lot of this is still stemming from some of whether they're HVAP Joint Commission, you pick it, or CMS kind of guidelines. I do have Chris. He's our, he's one of our resident experts when it comes to some of this. I know he's not an infection prevention guy, but Chris, have you heard anything in any of the circles? I'm just saying the BJC side at all?
So I think, like you mentioned, Phil, some of it is what from a regulatory perspective is required. I think, like with everything else, there's regular assessments going on to make sure that what's being done is actually producing the result that you're looking for. I know from a BJC perspective, there's not a plan in place right now to move forward in that direction, but it is something that we've been talking about to make sure we're getting value from that. And I think other healthcare systems, at least on the Missouri side, are also having a similar conversation.
Indeed, I will. I am going to reach out. I'll do a little bit more research. I've been getting the question, general staff sometimes about when is that going to be relaxed in general. So I know we're all getting to that. I don't say antsy state, but it kind of harkens back to what I started off with in talking with Dr. Bodeman and the things that he's seeing is folks, want to kind of get out of doing some of those things. But to Chris's point, what is the efficacy of what we are doing? Are we getting anything really out of it? How many folks are we turning away that could have potentially infected someone, or is just maybe mask awareness and monitoring probably the number one thing we need to do. So I will do some more research, but I believe it all lies in the CMS world, and they put out a lot of the best practices and guidance and things of what we should be doing. A lot of folks aren't too keen on dropping off that until CMS says it's okay to do so, but I will try to find out for you, Eric.
Hey, Phil.
Yes, sir.
Got another thing on that line, but real quick, since Eric Brandmeier just talked, I do want to throw out one quick kudos regarding our homebound policy and addendum to the vaccine. Steve Nicolason, who's the EMS coordinator at Anderson, is the one who developed the plan that was the first one approved in the state, in which the other systems used to help build their policy. So I did want to bring up Steve Nicolason, since Eric is his boss, and just say kudos and thank you for that. And then the other thing is, I think Georgia has a question that kind of lines up with this, screening pre-surgical, I believe, Georgia, don't you? That maybe some of the health departments can help you with.
Yeah, we're still COVID testing before patients are getting sleep studies, PFTs, any kind of surgery, admissions. Is everybody else doing this? Is it still necessary if the patient's been vaccinated and has no symptoms? Crickets.
So I think it was Beth. Was that directed to Beth? Beth, do you
Anybody?
that you know of?
I'm not going to say what my opinion is, but I'll check into that for you.
Okay, because we're having a lot of patients, they're asking us, hey, I've been vaccinated. Why should I have to get tested? The whole point in getting vaccinated is not having to go. Yeah, so people are canceling on us because of it.
Sure. Yeah, and that makes sense. Like I said, I'm not going to give you my personal opinion, but I will check into that.
Okay, thanks.
Thank you. Thanks, Jordan, for the question, and thanks, Beth, for looking into that. And if you would just courtesy copy me, and I'll share that along lines, to all the coalition members as well. Okay,
Sure.
So we will move on into our traditional stuff. I know, Greg, you've had an opportunity for a few things. Did you have any additional updates from IDPH perspective, EMSC, da-da-da-da?
I do not.
Okay. All right. And as usual, Beth, did you have any additional announcements that you'd like to share with the coalition?
No, I don't think so, Phil. I appreciate the opportunity, though. And just on a side note, we've had some changes in personnel. I probably need to send you those emails so you can add them to your list.
Okay, we'll do, and we'll send them a link to the member plan and make sure they get signed up. Perfect.
Okay, thank you.
Thank you. All right, we'll move over to our partners across the river at STARS. Dale, you're on. Any updates?
Nothing real significant. Looks like y'all guys are busting chops. We've most of you probably seen some, or at least some of you likely to have seen that the Dome is opening up today for vaccines. They're going to be doing 7 days a week. It is a FEMA sponsored event. I think they're going to be doing that for about 8 weeks now. And their goal is 3,000 vaccines a day. The target there is social vulnerable populations and supporting, because there's a lot of transportation that can get there, other means, that's where they're hoping to really drive that home for a while. I believe they're starting off with Pfizer and will eventually get to J&J or a mixed bag thereof. Let's see, what all else is happening? Really, that we just have a whole lot of small event. I say small events. Their intentions are 200 to 500 a day that a variety of different agencies are doing in the St. Louis metro area. We know that some of our EMS partners are doing homebound vaccines across the footprint, which is good. They're working with each of their public health departments to do that. And other than that, that seems to be about the biggest piece of it. I don't have any numbers specifically to share. The state of Missouri provides a pretty good website on, vaccinated, and they're updating it so that it's sort of first dose and completed doses. Although there are some data to issues, it's not significant enough to cause too big of a problem down at the county level. So that's really the vast majority of it. Yesterday, we learned from our state DHSS partner, who had been on a call with our regional HHS partner, our representative, that the Hospital Preparedness Program grant is supposed to be released this week. course, we've been hearing that for quite some time, but this seems much more definitive. It's supposed to be released by Friday. Probably will be on Friday. For us in our region, the indication is that we're not receiving any additional funding to the state of Missouri or to any of our contractors, which STARS is one of those. I know y'all roll that differently in Illinois, but just for your kind of awareness of what we're seeing on this side. That's about it, I think.
Okay, well, thank you for sharing. One question I did have with regard to the folks at Dome, will it be specifically, you said it was going to be a FEMA run. Is it going to be specifically for St. Louisans or Missouri residents, or will it be open to any and everybody? You know, so folks, you know, maybe driving like we kind of discussed a little bit ago, you know, we do receive folks down here from Chicago routinely who want to get vaccinated. So would it be something that's fully federal that folks from across state lines would be able to go to? Do you know?
So Missouri has placed a preference. So, you know, it's one of those really weird things is that there is a preference for Missouri residents. And I know the Dome, there is a preference for City of St. Louis residents. That being said, the registration is through the Missouri State vaccination website, you know, the registration there, and then you'll receive the email. So, you know, the folks who pull those triggers are, you know, in the background of all of that, and I don't play any role in that. So it is supposed to be, as again, Missouri specific and St. Louis City specific, but you're not prohibited from registering, and it's not like they're going to, you know, I mean, if you get a ticket, then somebody gave it to you. But it is a registration event as far as I'm aware of, particularly right now in the beginning. It may open up a little bit more, you know, later. Because the St. Louis is folks from St. Louis are going outstate to get vaccinated. And, you know, we won't go into the interesting politics of what the vaccination rollout was, but, you know, we do know that the metro areas, in particular, vaccinated a lot of folks from non-Missouri, and which caused some beef in Jefferson City. And that's due to the, you know, who people worked for and where people lived. And that should have been anticipated, but that's neither here nor there. And we've all lived through that. So it's a really long answer for you, Phil, but hopefully it kind of gives you the, well, you can register, but I don't know.
Well, thank you, Dale. No, appreciate it. And yeah, politics aside, I do understand, you know, how, you know, always a touchy subject. And hopefully, you know, as these PIOs all get together, they can come up with a good consolidated message. You know, they can be broadcast on KMOV, blah, 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 all the, you know, all the stations out there. So folks will just be informed, at least, you know, that helps. But again, the demand curve in many instances on this side of the river is slightly, again, like I said, slightly turning down. But we want to make sure we're able to point folks in the right direction so they can take advantage of those opportunities. So again, thank you.
Absolutely. Yeah. You know, if it was up to me, it's everybody show up. So, you know, I will let everybody know that Friday in Missouri opens up to everybody over the age of 16. So it's an open forum at that point. And yes, reflective of you, we're hearing from our outstate partners that they are seeing a downward trend in arms showing up for vaccines. So we'll see how that goes in the next few weeks. Thank you, sir.
Thank you. And Sue, I see you had a question.
Yes, I was wondering if you could speak more on the virtual functional exercise schedule for April 20th.
Oh, yeah. So appreciate that. That is, it's part of our Complex Coordinated Terrorist Attack Grant. It is a functional exercise that pretty much goes from threat neutralization to moving into the ongoing response. So that extended response period, command and control, moving into phases of recognition and of the need for family reunification, the messaging and establishment of family reunification. There's some back and forth with planned from some communication points from EOCs and command to the potentially hospitals, reunification centers, that sort of thing, in getting that stood up. We do have it in 5 locations, so it is on both sides of the river, and it is virtual, and it's a driving conversation. There's not a lot of plans, particularly in Missouri, around family reunification. And none that have been tested in any recent time other than New Madrid seismic zone kind of stuff. So, which is not for our region, right? So reunification at that point primarily goes out of the St. Louis region. So nothing like this has been done. It is virtual due to the COVID environment that we're in. This is the last of our exercises as part of this particular grant. But the program itself is going to continue, and we're going to build from this exercise into working with that reunification process. What does that look like? What does that? I mean, just that whole process. We've got some grant funding set aside from another grant, so it's to ask a lot of questions because there's not a lot of plans already. But anybody can join. You can. We are looking for players, participants. Certainly you can, step back and observe and listen in as well. I'm happy to have folks from all parts. Thank you for asking.
Thank you so much. Thanks, Sue, for the question. And again, Dale, thanks for the additional information. All right. I know, I didn't see if Mike or Eric, they're still not on, and I think Lee had to drop off. Lee, you're on. Any REMERT updates?
Yeah, so actually this weekend, REMERT will be operating in support of the St. Louis Marathon. We'll be providing medical coverage as well as providing both on Illinois and Missouri side under a mutual aid agreement with the city. So we will have a full deployment of people. They cross over into Illinois for roughly 11 miles of the course. And we've done all the medical planning and everything actually using V4H. So looking forward to seeing how that goes. Hopefully it will be decent weather, not hot, not cold, and not rainy.
As you can see, Lee is full tilt in the madness of a vaccine clinic right now.
Yeah, I'm sure you can hear the noise there.
Yeah. So we've made a few changes to our vaccine clinic and compressed it by an hour. So it's a little hectic sometimes. So all right, thanks for that, Lee. All right, I don't think Dan is on, just Dan. And Sue, just by chance, any updates on disaster mental health team by chance?
No updates on the mental health team.
Okay, no problem. Thank you so much. All right, few updates on the grant. So our grant status right now. So the FY 21 grant is approved, finally, and currently working in NCE, a no cost extension through January of 2022. So that's a good thing. I'm currently adjusting the work plan that goes along with that grant. I'm just going to have to adjust some dates. We've shifted a lot of things, obviously. Some things we still cannot do, so I'm going to take out of the work plan. And maybe we'll get to be able to do some of them by spring of next year. But some things I will be removing from the work plan. Should not be too, it won't bother the overwhelming majority of folks. It'll be less things to do, which is good in my opinion. And several things were, as was this past year's grant, several things were removed from the federal requirements to do. As you guys kind of remember, we were doing our coalition surge tests each year. Those were, kind of shelved for the time being until further notice, and a few other things like that. So nothing too crazy about that. And we're gonna, I know Christina is working on your paperwork, and you guys should be receiving that. So please, if you can be as responsive as possible for those of you who did have grants approved for the FY21 grant. So again, this one will go out through 1 January 2022. Simultaneously, we will be kind of approaching our next grant, the FY22 grant. And for those of you who have started to fill out your project requests there, again, I'll ask you to make sure you get them in there. The suspense for that is, excuse me, did I have 414? Yep, 4/14/21. So next Wednesday, that form will shut down. You can find it through Member Planet. You can use this link that's on here. I've sent it out via email to the entire coalition as well. So if you're planning on submitting for FY 2022 project, please get that done no later than next week. Please. It doesn't take much to fill one out. And then after that, we'll work with getting our paperwork and everything together. But as of right now, there are only 4 submissions, and I believe I know at least one is one that we're putting together here at Memorial. I think Georgia has one submitted. I'm not sure who else has one off the top of my head, but there are only 4 submissions nonetheless. So please, if you would like to do a project, please get that into the form submitted, and we will consolidate it when we finish the budget for the upcoming year. Any questions with regard to the project requests?
Yeah, Phil, for 21, this is Eric.
Yes.
All of my forms have been submitted for quite some time. Should I reach out to Christina, make sure everything's okay? Because I haven't heard anything back for weeks.
I honestly thought that I saw something from her. Was it yesterday? I was swamped at vaccine clinic yesterday, actually. Yeah. But I thought she had sent. I thought she had sent you guys something yesterday. I'll double check. So she's been knocking these out. I've been seeing the ones that she's been sending out. I just can't remember if I saw yours not yet. So, okay. But she's been sending them out. So, yeah, you can always shoot her an email. Just courtesy copy me, and I'll follow up with her as well.
I was just trying not to bother her. I know she's busy like all of us. So.
Yeah.
Okay.
We get it.
And as far as we had talked once upon a time about trying to use grant funds moving forward to help us regionally, almost like from an SNS standpoint or idea from a PPE standpoint. Was that attached to either one of these 2 grants specifically, or is that something that we're just going to wait on after this calms down even further?
Sorry. That takes us to this next slide here, which
okay, sorry.
It's no problem. No, it was a great segue. Takes us right into our supply chain integrity assessment. So Lee's worked on, I think we talked about this last week a little bit, but Lee worked on a form. Lee and I both worked on this form. We're taking the lead from, I think it's the North Florida Coalition, Healthcare Coalition. And it's a short survey, and this is going to be kind of the start of that. I'd like for it to be kind of a part of what gets us there. I'm just not sure we'll be able to do it. Not too sure if we'll be able to get it all done in this in this upcoming grant, the FY22 grant, directly. We got the form going out through 5/21/21 for everyone to fill out. So I wanted to give everybody about 6 weeks to get that information. The form, honestly, isn't too in-depth, okay? We're really looking at suppliers and some of your challenges over the past, actually over the past 10 years. So that's why we're kind of giving you a little bit of time, but to get that knocked out. But this is going to be kind of the launch point for how we can kind of restructure, as we've discussed in the past, how to better manage the supply side for, during a I'm not just going to say during a pandemic, I'll just say during a crisis, and something that's an all hazards version of supply chain management that works for everyone. What I will say is this, though. Some of you may remember, I think it was my first, maybe it was my first, maybe it was my second year here. I tried an initiative during one of our regional meetings on the EMS side with regard to our disaster bag. Some of you may remember this conversation. But there was, if you guys all know, we all have disaster bags, right? And in those disaster bags, and they're primarily directed at the EMS folks, right? If you look into the IDPH, plan, it lists out what goes into that disaster bag. I think even the EMS Act or some part, correct me if I'm wrong, Greg, says that we have to maintain these items and, pieces of equipment, et cetera. Fluids, blah, 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 that we need to have to support EMS in the field and or an alternate care site. Well, Phil's bright-eyed, bushy-tailed newness said, hey, how about we we go for a universal kind of bag that everybody has the same stuff in it, so, and I'm just going to use, for example, blind insertion airway as the supply in question. Can we all agree upon a single supply, can we all agree on whether it's a specific brand type, whether it's a King's Airway or if it's a Lee, correct me if I'm wrong, LMA, any way of some form of blind insertion airway. All I really want to do is say, hey, can we agree on one to have in all the bags? So in case they all go to a singular location, we'd all have the same thing. And yeah, I was beat up pretty bad about that after that was a no-go during that meeting. And I really just wanted to get, some things universally accepted. Some of the challenges that we had there were different EMS systems trained differently, right? So I'll just use Anderson specifically. Maybe Anderson at the time was using a King's Airway, and we're using something else in our system. So the docs would not agree and train to a singular standard. So I only say all of that to say, in the end, what we've noticed here during our COVID, I won't say problems with the supply side, but for lack of a better term, the problems is my organization may use the 3M 1860 N95s. Eric's organization may use brand Acme N95s, and they test their folks to it. Anytime we introduce something new to an organization, there's training, education, and potentially in just with N95 example, fit testing requirements that need to occur. So as you're filling out part of this supply chain integrity assessment survey, some of the questions we'll kind of talk to that a little bit, but in the end, we're going to have to either come to an agreement on certain things, that are universal disaster supplies that folks are going to either be able to use just-in-time training to support them, or we're going to have to say, hey, is this something you may want to switch over to as your day-to-day or some hybrid thereof to make it feasible for us to do so. I can only imagine how some of the organizations had to deal with and shapeshift to fit whatever we did receive from, whether it's the state's SNS or the federal cash or what have you. It put a kind of wrinkle in your day-to-day, but it was a disaster. It's COVID. We all made do. We all did something. When our supply chain failed, we received something, and then we did the best we could with what we had when we received it. My goal would be in this at the very end that we kind of trim all of that fat and have something that's actionable in a time of crisis. COVID was actually a slower burn than any other disaster that I've probably been in probably the past 20, 25 years. It was a much slower burn, start November of 19 through January 20, and then March came, and then things kind of really heated up. We still even had time there to make, some corrections, but we still weren't able to, in my opinion, right now. So imagine that on a much more accelerated level when we do have some of those seismic shifts here from the New Madrid, or we have KC-135 land short on final going into Scott Air Force Base and have to deal with the outcome of that with 400 souls on board. So those are the type of things that we need to be able to support universally without making it too difficult for an organization, whether it's EMS, I'll even put our fire folks, our fire paramedics, as well as our hospitals, without putting you in too much of a cramp in your style, so to speak. So I know I said a lot, but the goal of this is to try to make us more efficient in the end and still meet the demand or that need during the crisis. We need to meet it at the time of crisis instead of trying to work through it the way we did with COVID. I said a lot, but any questions with regard to that, with supply chain side, the survey, any of the things that Eric said? Sue, I see you got your hand up.
Yeah, this slide says form closes next week.
Yeah, it should not say next week. The actual date is 5/21. Yes.
Yeah. So, and then also the short URL link is identical to the one on the previous page for the project requests. I mean, did you just copy and paste? Is it the same short URL?
Let me take a quick look. Give me a quick second. And that may have just been my fault. Oh yeah, because one should be a bit.ly. I'm surprised that did not cross over. Now, if you click on that one, I do believe I'm gonna check it myself because I did put in. Give me a quick second. Yeah, you may not be able to type that one in directly, but I do believe you can click on it and it'll work. So if somebody's out there with the document in front of them, maybe they can click before I get to it. I'm almost there. Coalition meetings. All right, let's see. And if it doesn't work when you click on it, I will make an adjustment to it. So project request one, I'm checking it now just to make sure that one works, and I will check the second one as well. In one quick sec. Yeah, so I'll just have to adjust that one, looks like. Yeah, and it said it could not open that one. So I'll fix that, and when I send out the link to this, I'll send out an adjustment on there with the correct links. So thank you for identifying that. But yeah, I was using this kind of same slide, so I must have just copied and pasted.
Hey, Phil.
Yes.
So, not speaking of the grant that's coming up that people are going to be putting in or have put in for because I get confused in what BP we're in.
What year we're in?
How many buckets of money do we still have that we need to spend that isn't earmarked for anything at this point? There was.
And you're talking about in our current NCE, correct? The one that we're finishing up, the one that Teresa's talking about?
Whatever we had, the no-cost extensions, I think there was a COVID bucket.
Yep. I can tell you offhand. Yep, I can tell you offhand. So we have approximately, let me see if I look at my board right behind me. We had $488,000 remaining, of which $337,000 is going towards I think what's the quantity? 23. I think it's 23 ventilators that we were able to get, and those are the X vents. We talked about that I think 2 months ago on the call. So that is actually moving forward now, which is good. So we'll have those, and we will redistribute, and that will get rid of our aging. That will kind of replace our aging impact. Those old impact 154s or 754s univents that we had. Very EMS friendly, can do a little bit of everything, 10-hour battery life, much better than what we have today. We got a great deal with the folks at Zoll on that. After that, we do have another 100,000, 100,000 directly in what do we call them? Disinfectant systems for our ambulances. So between those two, that's going to take up all the COVID money, but the rest of it will go to the rest of what we do have. So that other 100,000. So we have 438,000 total in equipment that's going out there. So those 7 or 8 disinfectant systems, I don't have the quantity in front of me, we'll be going forward with. And then after that, we do have some tight fitting, we call them, they're called halos, but they're respirators. We discussed them maybe 6 months ago, but we're going to try to test those out as an alternative to the traditional PAPR. So once we get them in, we'll be probably looking for a hospital or two to help us test them out. And that's about 20,000 there and another 10,000 in supplies to support those. So, and that kind of takes us out to 480,000 and change thereabout. So it's really three big ticket items remaining. But our good folks in our supply chain director at BJC is actually helping us kind of hand carry those across the line so we get them in before June. So we hopefully we'll have everything in hand in the month of May, maybe June, but definitely all paid for by then.
So we won't have any money left on the table.
Nope. Well, we'll probably have like $900 left on the table, but yeah.
Okay, I know that the state has asked all the regions to let them know if there's going to be money left on the table and to, because they will earmark it elsewhere, and I just didn't know what our region was thinking, whether we were going to be giving any of that money back or whether it was all going to be used. So
yeah, we should have it all used, and thankfully, I mean, I'm glad that we really got a good deal in the vents, and our partners at Abbott and MedStar, I think, will be very happy with those. And I think they're actually, some of them are actually using this form of vent. We're actually going to put those into practice in the day-to-day use as well, so we can have some good just-in-time trainers available should we have to get some out to, let's say, get something out to Jersey or Boyd like we did during COVID with some of the ventilators that we did receive. So, and speaking of those ventilators, they're still working a plan. The state is still working a plan on returning the vents that we did distribute that were provided from the SNS. So there were lots of good and bad. There's lots of good and bad feedback on the vents that we did receive. Probably the biggest, I guess the worst feedback we got is that it's definitely a bedside vent only, not really suitable for indoor-outdoor use. But it's one of the Cadillac of all vents, as some folks would say. But even still, we've got intensivists and folks here in our ICU that didn't want to use those vents. I don't know if anybody else had that feedback from the vents that we received from the states. And I'm not talking about the LTVs. I'm talking about what's the model? It was the Philips. Lee, do you remember the model number?
EV300.
The EV300. That's right. So didn't get a lot of great feedback from it. Some folks really liked it, but we did have some instances where like, can we get something else? And it's like, beggars can't be choosers. We're not in that position in the middle of a disaster. So.
Yeah, respiratory therapy loved them. It was just simply the docs who weren't familiar with them. That the size, this can't be as good as my big monster that I've had for 20 years.
Exactly. So, old habits die hard, I think, sometimes. All right. Any other questions from around the community here in the coalition? Anything anyone would like to share? Okay. And before we break, I'd like to give folks just an opportunity. If you did get on the call after we did our roll call, you can take an opportunity to sound off now, and we'll make sure that we know that you were on the call here today. Anyone?
Vicki with Monroe County.
Thank you, Vicki. Anyone else? Hearing none, we will, we had Sue had one question. Go ahead, Sue.
You still have another page to review on upcoming events. What is this AARP IP?
Oh, yeah, thank you so much. Yeah, our regional AAR, that's the date. I'm going to send that out as an invitation. So we're going to conduct it virtually. But on our last call, I'd said start thinking about things about COVID in your local AARs and things we want to bring to the table. We're going to do this from a regional perspective, but I know there's going to be a lot of internal things, but mostly we want to do it from a regional perspective. We are finalizing a survey to do that as well. So that'll go out with that meeting invitation. So just an opportunity for us to gather up and, all the pros, cons, goods, bads, uglies, what we can do better next time. And it won't be next time for a pandemic, but next time in regional response, whether it's of this magnitude or smaller. So yeah, that will be our after actions review, and we'll put together an improvement plan from that, have some good outcomes, hopefully, from that review. All right. Thanks, Sue. And thanks to everybody on the call. We will talk at you next month for our coalition meeting. For the hospitals that are online, we're not going to have a hospital pulse check this afternoon. This will serve as that. If you have any questions, concerns, or needs, feel free to email myself, Lee, Scott, or Eric. Doesn't matter. We'll get a response back to you. I will be adjusting the supply chain integrity assessment link. So when I do send out these slides again, those links will be adjusted so you guys can have access to those, direct access. But you can always access them through Member Planet right now. They are available. All righty. You guys have a great rest of your week. Talk at you later. Bye.